So for any clinician, any medical legal issues can be a nightmare. It can bring a worldwide wind of the problems one by another. If you want to move out of it, you require a strong intellectual personality and trait to be out of it. So I'm inviting one such personality, Dr. Bela Verma ma'am, a highly intellectual ma'am, is a HOD of JJ Hospital, and she has so many feathers in her cap, as you can say. So as Arjun was guided by Sri Krishna in Mahabharata to tackle the war, how to tackle the medical legal issues, ma'am will tell us. Bela Verma ma'am.
डेस्कटॉप पे 1 मिनट में चेक कर लेते हैं कहाँ पे बेटर सेफ
ये थोड़ा पीछे लेना 25 से 30 भी हो जाएगा ये बहुत पास में है अरे भाई ये बहुत पास में है Yeah, good evening, everyone. I'm really grateful and thankful to the handful of audience over here who have stayed back to actually hear this talk. Sad reality, because this is one of the most important topic that actually is required for each medical practitioner today, and we will see how. So I would like to start my talk with a few Next slide. Yeah, okay. So now a few headlines, if you can see. When can doctors be held liable for medical negligence? Doctors worry about prison time. Medical negligence only in case of clear deviation from practice. Doctor provides his own and wife's mobile number for emergencies, but mobile was switched off. There is deficiency observed by the court. So this comes under BNS section 106. This is vicarious responsibility. 15 years after death of patient, summons issued in medical negligence. Doctor told to pay for death of child, left unattended. Court fines doctor 5,000 for poor handwriting. Negligent medics face up to 5 years in jail under new laws. This is again section 106 of BNS. Docs can't prescribe anti-cancer drugs via teleconsultation. SC sets 11-point norm on medical negligence. 3-year jail term or rupees 1 crore fine for medical negligence. The last one, nearly 50% of government prescriptions deviate from guidelines. I hope I have attracted enough attention, and I hope that now I have whet your interest in listening to this topic, which I feel the rest of the audience felt was not important for them. So actually speaking, we have seen that over the last so many years, medical practice has undergone a drastic change. It's no longer a noble profession, and we are now liable for legal responsibilities, financial liabilities. We also attract personal threats, acts of violence, and even imprisonment. So what was once considered a noble profession is now a commercialized profession. We are under the ambit of the Consumer Protection Act, and therefore we become service providers. So it is important the way we attend CMEs and conferences to upgrade, educate ourselves with the latest in the medical field. I think the need of the hour is also to upgrade ourselves and our knowledge regarding the medical legal aspects and the changing laws for doctors. So medicine is an art, is a science of uncertainty and an art of probability. So said Sir William Osler. I have divided my talk roughly into 3 categories, that is medico-legal negligence, errors in medical practice, and how to mitigate the risk. Now, the topic is so large that every slide of mine would constitute a lecture for 1 hour. So please bear, because it may have turned out to be partially like a theoretical lecture. I have not put cases here because I thought I need to first impart the basic aspects of legal responsibilities, the rules and laws that everyone must follow. So the most important foundation of a successful medical practice is the relationship between a doctor and patient. So it is a foundation which is responsible for our successful practice. And this is based on trust, warmth, hope, empathy, and communication. These are the 5 important pillars of a good doctor-patient relationship. So the minute a patient walks into the clinic of a doctor, it is an unspoken, unwritten contract between the two that this patient seeks the treatment from this doctor, and it's the doctor's moral responsibility to give this patient a reasonable care for his right to survive. Right? So this is an unwritten contract. It's nothing. We never write कि आप मेरे से treatment लोगे. It is understood. But the foundation that the patient will trust the doctor, will adhere to his treatment plan, will come for follow-up regularly, depends on what confidence you can build with him, what trust you can instill in him. Now, the basics of legal aspects in medical practice: ignorance of law is not the excuse. In the court, you cannot say, I did not know this. And therefore, you must learn, upgrade yourself, train and educate yourself related to medical practice. These are some of the few basic things I have just put up here. A few of them I will be discussing. The rest, I would request all of you to kindly read and educate yourself, because I cannot do it in 25 minutes. But these are some of the important aspects. Now, medical legal negligence I'll be speaking on. But how many of us know that the NMC Regulations 2019 has brought us under the ambit of the Consumer Protection Act, and they are much more stricter, much more stringent than the Indian Penal Code. And therefore, we just saw in the last the newspaper clip that I showed you, any rash treatment, any medical negligence leading to the death of a patient invites imprisonment from 2 to 5 years for the doctor. So imagine that we have to save ourselves from such litigations where maybe the death of the patient was obvious, it was unavoidable, but yet a litigation is put on you. And there your documentation will come to your savior. Yeah. And also please know that the IPC is now the Bharatiya Nyaya Sanhita of 2023 and the Bharatiya Nagrik Suraksha Sanhita of 2023. You can read this in detail. It will be available online also. We'll discuss a few of the important things in the coming slides. So medical negligence is a breach of duty of medical care by a physician or a surgeon, which will lead to the harm or injury of the patient. Such a harm or injury can be physical, emotional, or financial. The breach of duty can occur through an act of omission or commission. I will give examples. Medical negligence can lead to civil or criminal litigation. That means it could be included in the consumer courts, resulting in legal action. So imagine, so far we have been safe, but one day something happens, unfortunately, and you find yourself entangled in a legal dispute. And that is the time you may regret that you didn't know or you did not take enough precautionary measures to avoid this situation, because it can have very serious repercussions on your practice, your reputation, your further future life also. And we have enough examples. We know of the gynecologist who committed suicide, I think Rajasthan. Okay, so such things do happen. We think it happens to others and not to us. So we have to be careful. Now, Ethics and Medical Registration Board, the AMRB board, is a one which has been in place, and it has been adopted with few amendments by the NMC in 2023. There are 8 chapters in these regulations, very important 8 chapters. I request all of you to read. Now, ethics is a science and knowledge which deals with the nature and the grounds of moral obligations, distinguishing from what is right and what is wrong in healthcare. So what have the Indian courts done? They have developed this principle of reasonable care as the standard of care to be followed by the physician or surgeon when they are giving medical treatment to the patient. It simply means that every doctor and surgeon or physician and surgeon has to exercise a reasonable degree of standard knowledge, skill and care while treating any patient, and failure to do so will attract legal actions. Now, what is the standard that we deal with? So, in case there is a case, the court will judge that doctor based on his conduct and compare it to a hypothetical ordinary doctor or man who would do something or not do something in that situation or that category. So a reasonable skill and care is responsible. They don't expect you to know the latest in medicine and literature, but they don't want you to do some outdated treatment which is now obsolete. That means some basic knowledge of the present day management at least has to be there. Now, few examples. Suppose I say that I have a patient of nephrotic syndrome. I have been able to treat him for the first episode. He comes back for a second episode. I again managed to treat him partially. But then I find that he's having complications. He's not responding to steroid. This is the time I should refer this patient to a specialist, to a nephrologist. Not doing so is an act of omission. Okay, so I should not be doing it. I should have referred this child. And suppose he had complications and he died. So this is wrong. So such things do happen, and we should know what are our limits and skills that we have. And whenever a timely referral is required, please do refer. Or just tell the patient, my knowledge gives me only this much limit to treat you, and you now need a specialist. Because in government hospitals, we usually don't have these problems. The patient just lamely listens to us. But I know that private practice is a different ball game, because he will ask, wo wala doctor ka fees kya hai? You know, things like that. You have to tell them many more things. It's not free consultation with a specialist either. Now, what do you remember for 4 Ds of medical negligence? The duty, that is your care of patient, and the doctor-patient relationship, which I'll tell a little more in detail. Dereliction of duty, that's a breach or deviation from the standard of care. Damages that have occurred, and you are responsible as a direct cause between the breach of duty and the care and damages. So these are the 4 Ds you can simply remember, which we have to follow. Now, what is vicarious liability? And I'll give you examples of this with true cases. So this is a liability of acts and omission by an employee or some other individual for whose conduct the employer is legally responsible. So what happens is, in private setup, in a private hospital, this is a real case of a very big hospital in South Mumbai, where one of the intensivists went on a holiday for a few days, and he left 2 doctors in charge of his intensive care. Out of that, one 14-year-old patient died, and then the case went to police. It became a medico-legal case. So the doctor who had gone on leave is to be implicated or not? He will say, I gave the responsibility to these 2 doctors to take morning, evening rounds. Out of these 2 doctors, one doctor never saw the patient. So actually, this is vicarious responsibility. The doctor who went on a holiday and left 2 doctors in charge is the responsible person for this patient. So that is what is vicarious. So anyone who's employed with us, any junior resident, any nurse, or a compounder, so-called in the rural areas, you give them the responsibility of doing some work. It is only delegation of work and not responsibility. So the employer or the person who employed them or gave them the responsibility becomes the legal person in charge of this, and the action will be initiated against them. So there was a case of these parents against the patient who died. So there are various levels of disciplinary actions, and to simply put it in a few lines, exoneration would be, suppose a doctor acted in good faith in an emergency situation to save the life of a child, he will be exonerated as no fault of his. Level 1 is the simplest, where a reformation is advised, advisory instruction, warning is given, and the doctor is left off. Means there has been a minor error and nothing serious has occurred. Level 2 would be no role in the direct harm, but there has been some breach in the conduct, and so the suspension of license for up to 30 days. Level 4 is responsible for direct harm, and breach of code, punishment for 3 months to 3 years. And level 5 is permanent deletion or suspension, and you will never be allowed to practice again. So we should know what is there in store for us if there is some error which has happened, and take all precautionary methods that even the slightest or most minor error should not occur in our practice. Now, errors are inevitable, unfortunate, but a reality of medical practice, and it encompasses a lot of things. So, safety would be the priority is safety of the patient and his right to live. So, that is the first thing a doctor has to ensure. There could be unintended events that harm the patient, medical errors like delayed diagnosis, misdiagnosis, wrong diagnosis, adverse events like preventable, unpreventable, and these are measurable disabilities. So, a patient is on a ventilator and he develops ventilator-associated pneumonia is an adverse event. Okay, we could have prevented it, we could not have prevented it. Adverse drug reaction, somebody was just asking in the last panel, including unintended and an undesirable effect of a drug. So if a drug is really responsible, really required for the treatment, it is to be explained to the parents that these are the side effects that you could expect with this drug, and therefore please come for regular checkup for a CBC or whatever labs you want to do so that it can be stopped in time. Medical error can be serious, minor, near-miss errors, and therefore we have to take care. Now, medicine is an art and science, and it's not a business. Please remember this. How to practice and be medico-legally safe. Now, this is something which I'm going to take up again in my future slides, so I'm going to skip it right now. And errors could be an error of execution where the correct action did not proceed as intended. It could be the person who gave the directions which were not clear, concise. So it could be execution by someone else. But it is your responsibility. Error of planning. So the original action is not correct. Suppose I have a patient of empyema in the early stages where I can give antibiotics or give intrapleural fibrinogens, and suppose I can contain it, and I did not do it. Or a patient came to me in stage 3 empyema and required VATS, and I did not do it. I kept on giving him antibiotics for 4 weeks. It's not going to help him once it is in stage 3. So we have to be very careful when we plan the treatment of any patient, and a critical incident could be a mishap that's clearly an occurrence that led to an undesirable outcome like prolonged hospital stay, death, or permanent disability. So what happens, suppose a patient has undergone a surgery and he has incisional hernia which prolonged his stay, he need a resuture, there was pus. So this is unnecessary increase in the hospital stay. Permanent disability, someone giving a wrong intramuscular injection and damaging the sciatic nerve, which leads to problem in the neurological deficits in the lower limb. So this is a permanent disability. These are very serious types of errors. One of the most commonest is a faulty prescription, again partly discussed in the last panel. We do not know how to write our prescriptions. Wrong patient, wrong drug, inappropriate dosages, incompletely written prescriptions. So prescription writing is an art and skill too. And remember, every paper you write is a medical document which will be produced in court, including your OPD paper, your indoor paper, your vaccination file, and your drug doses, your treatment paper. So remember 6 R's. Always reconfirm, recheck, right patient, right drug, right dose, right route, right time interval, and right documentation. So prescription writing is posology, which is a science which deals with the pharmacology of drugs, dosing, and it has 7 components when you write a drug. So you write the complete drug, tab, PCM, 500 milligram, 1 TID into 7 days. So you need to write the complete thing. Also, a prescription has 4 parts. It has a superscription, it has an inscription, it has a subscription, and it has a transcription. And below has to be the name and sign of the doctor, legible handwriting with the date. So prescription writing is a separate talk on itself, and that we can do some other time. Now, adverse drug reactions, unfortunately, again, we do not know which child will have a rash with ceftriaxone, which child will have a rash with amoxicillin. This is something we cannot predict always, but any noxious, unintended, undesired effect of a drug which is used for prophylaxis, diagnosis, or therapy can cause an adverse drug reaction. Error can be error of commission, an action performed is incorrect, or a wrong action plan is used, or an error of omission, where the action is not performed as it had been done. So we've heard of examples of right eye being operated, the wrong eye, the left eye needed, the right eye was operated, the left limb needed treatment, the right limb was operated. Such things have happened. Operation after a surgery, a gamgee or a scissor is found in the abdomen. So such errors are preventable errors. Okay, and we must take care. Today's busy life, most practitioners have no time to pay attention to a lot of things, and that is something that is sad. So just to say a list of error of commission, wrong diagnosis, illegible prescription, improper management, lack of patient information. Again, when you are giving a drug which you expect to be, little more toxic. So giving digoxin, never mentally calculate digoxin. Always write and calculate it, because it has decimals. Overdosing can cause the death of the patient. Drugs which are given for long term, anticonvulsant drugs, ATT, steroids, if you do not give proper instruction, this patient is going to come with complications. Drug interactions, please know your basic pharmacology at least. Do not attempt to give wrong drug doses, duration. If you don't know, please read up, and always monitor the child. Call for regular follow-up with the drugs so that you can check what dose he is taking, how much he has taken. You can, even check the pill strip and all, and find out how many pills he has taken. Omission, not calling for follow-up, not notifying notifiable diseases to the surveillance team, failure to coordinate with others leading to delays, failure to perform preventive care, like not telling about immunization, not telling about vaccination. These are serious errors. Failure in information about transfer. So this is a newborn, I find that he has abdominal distension within 24 hours, he is vomiting, and I need to refer. But you are not there. You tell your nurse to do it, and she doesn't do it properly. Failure to educate the parents. So these are all our responsibilities as medical practitioners. Now look at this. This is a WhatsApp joke which would go around. अरे डॉक्टर साहब ये कौन सी दवाई है? ये पैरासिटामोल है. And this, ये क्या है? ये तो मैं अपना पेन चेक कर रहा था. Okay, now this is like a laughing matter, but not really a laughing matter. This illegible handwriting of Madhya Pradesh went around everywhere on the groups. Remember it? This is from some government place. MJPJY and all, what Ayushman Bharat is written. Who can read this? And this patient went with this prescription. Look at this. No, the chemist could not read, so the patient came back. Now look at this. No date, no sign, incomplete drug dosing. How many days? What is half-half? I don't know. Nebulization is half-half. Okay. Syrup something, 2.5 ml. Take it on for a year. What is this? So you can't get away with this in court of law. They have never been caught. They are very lucky. A day will come when they'll be caught. Okay. So don't do this. These are actual prescriptions which come to us, and it is a real sad reality for us. So medical errors, again, like I've already told, treatment procedure. So every procedure needs a consent. We'll come to that. It could be failure of equipment. You're not responsible for it. There are man-made mistakes. Doctor fatigue, stress, overwork. Residents are overworked. Faculty or consultants are overworked. From one place to another place, 4 places consultation, working till 12 in the night with no lunch, no dinner. Understaffing. So we are making one staff work for 4 staffs. Poor training, supervision is not there. Heavy workload in hospitals. Who can work so much 24/7? And of course, lack of computerized medical records. Another serious issue, because documentation does not take place. People do not write everything in detail, and it is not stored, it is not preserved, and then you can fall in trouble again. Now, errors in vaccine, very common. We get a lot of calls. I gave an expired vaccine. Anything will happen to the patient? Will the patient take me to police? Do a police complaint? What will happen? So this is another talk on its own. on vaccine administration. But all I want to say is that no vaccine is 100% safe or effective. There will be adverse reactions. When a patient comes to a doctor for vaccination, especially in a government hospital, it is an implied consent. The parent has brought the child for vaccination. So we do not take a written consent. However, in private practice, in India, we do not have any written consent for vaccines like the US or UK. So what we can do is, in the beginning of vaccination, on your vaccination file, take one-time consent from that parent that this child will be getting these vaccines, which can have some minor or major adverse reactions. No need to take it every time. And of course, tell them, thoda bukhar, thoda sujan ho sakta hai. Especially after DPT, there is an abscess sometimes. And these errors have to be reported, however minor they are. Even if it is high-grade fever, we have to report it because it is the surveillance team which will discuss this. And the most serious one is an anaphylactic shock or death following a vaccination. So there are BMC, the municipal corporation meetings which are held. So adverse effect following immunization have to be monitored and they have to be notified. The most important thing, I am giving vaccinations. Is my OPD equipped to deal with an anaphylactic reaction? So such cases also come where there is no oxygen, there is no bag and mask, no pre-filled syringe of adrenaline, no trained staff to help for CPR. And suppose you have managed to revive this patient, which is the next place you can refer this patient to for admission. So whenever we start or we are doing something even in our practice, in our clinics, what you have to keep in mind is what I will do in an emergency situation. And we've had cases, a dentist, 8-year-old girl went for tooth extraction. She developed an anaphylaxis to the local and she died. She collapsed. But that doctor did CPR. He did take the child to the nearest, pediatrician and did his best. So he was not, implicated or penalized because he did what he could. Another example, a child is sent for a sonography and tapping to a sonography center. And while doing the procedure, the patient collapsed. And the sonography center had nothing to revive this child. So whose mistake? The referring doctor or the sonologist? Both. The referring doctor should assure that there is something available for this child over here, or he should be aware. So whenever you're referring, you can at least confirm that this referring place has all the basics, because after all, it's your patient, right? And the people who are doing the procedure should have taken a written consent. I'm not aware of the detail of atropine being given before a sonographic tap or not. But what I'm trying to imply is nobody anticipated patient death, no? But it happened. And a medical legal case is filed. So what we see is the documentation or record. We do not have the chance to talk to the treating doctor. What we have in our hand is a file. Okay, so we'll come to documentation. Now, telemedicine and teleconsultation, as far as possible, kindly avoid teleconsultation. It was allowed during the COVID times, but now better to avoid it. Telemedicine is where you reach out to a rural place for a patient who cannot be transferred, and there's a doctor or a medical person, healthcare person who's talking to you and you're giving directions. All this is also to be documented properly, and the same level of professionalism, confidentiality, documentation, diligence as in-person consultation. Please remember this. You have not documented what you advised. You have not documented the discussion you had over the phone, and this will land you into trouble if something goes wrong. As far as possible, avoid teleconsultation, WhatsApp consultation. How do we save ourselves from errors? It's only prevention, 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 prevention. Try to prevent whatever small problem also you can have. Please update yourself, train yourself, educate yourself. Communication is the foundation of a good doctor-patient relationship. Kindly talk to your patient. Let me tell you, communication skills are a talk on their own, but I will only tell you verbal, non-verbal, written communication, of which 55% is non-verbal. What the patient is observing you, your appearance, your eye contact, and what you're doing when he's talking to you. People are looking at their watches because he has to leave and go somewhere, or he's looking into his phone, checking his messages while the patient is talking. This gives a very wrong message, and this patient will never trust you for anything. He will just go to the next doctor. So communication is very important, and written documentation of whatever you're communicating. So documentation is the only armor and our defense in the court of law. It has to be done in chronological order. It has to be done with all the details of detailed history taking, clinical examination, drug allergies, somebody was just talking about it, the past treatment the patient has taken, see all his files, document what he has received, his labs, and also document what you are advising to this patient. And after documentation, we take the sign of the patient's relative. I have explained all this. We take a sign and we also sign on the right side. So that way the patient cannot say, nobody told me. So you have just told him, you have signed, and now I make the father sign. So this is what we do. Even for high-risk consent, we explain everything to them, write it down and take their countersign, because tomorrow they can easily put a false litigation on you, ki I was never told about it. How will you save yourself? It is only this documentation which is written about the communication that you will produce in the court and which will save you from going behind the bars. Preservation of documentation, clinical records, the best way is electronic health records if you can do it. And now the law says that 3 years for IPD patients. OPD preferably no, but if you have an electronic device, laptop or digital, kindly preserve it. Because after all, it is going to come to your rescue. Transparency, what you say, you do it. Okay, and what you're not going to do, please tell them. So a negative consult or a negative, what you cannot do, suppose a patient is in ICU, unstable, I cannot send for MRI or a CT because he is ventilated, I will write it down. MRI is available, but it's in the next building. So I cannot send this child, I write it down, MRI advised to see, but we cannot transport. At present, he is unstable. Tomorrow, no one can say, तुम्हारे hospital में MRI तुमने क्यों नहीं किया? So all these are important things. X-ray machine not working in PICU. We write it down. Tomorrow they'll say intubate kiya, X-ray nahi hai. And timely referral. So this is just in brief, but this is the most important slide for prevention of medical errors in your private practice, which will save your reputation, name, practice, everything. Hello. Just 2-3 more slides to go. I'll wrap it up in 5 minutes. Yeah. So this is the Doctor Protection Act. Kindly have a copy, hang it in your clinic, and please keep a soft copy in your mobile phone so that the police doesn't come and harass you immediately. So this is something, nobody can be arrested immediately, please understand that. So never fear the police. Always remember, court will say if it is not documented, it did not happen. This is a fact. You say, I was there for 4 hours. I was next to the patient. I was doing this. You have not documented it in writing. So you were not there. Law is like a Rubik's Cube. Just when you think you have solved it, it will twist again. The love of money is a root of all kinds of evils. The patient will never care how much you know until they know how much you care. And doctors don't just have duties, they have some rights too. Please read up the doctor's rights. I leave this as a homework. And in today's time, we are supposed to be a wholesome doctor with knowledge, philosophy, holistic approach, attitude, human touch, sincerity, compassion, competence, courtesy, everything rolled into one. So we are no longer human beings, but we have to be like this, sadly, and we have to try to be like this if we want to continue our medical practice. So this is my last slide. I hope we have learned some life lessons today. The spelling mistake is there, sorry. DPR is a deteriorating situation, appalling. So doctor-patient relationship needs CPR, according to me. So like you do a CPR on a dying patient, we need to do CPR on a doctor-patient relationship too. Be a patient listener, give time. It will solve a lot of problems and it will prevent your litigations because the patient will trust you till the end. Show genuine concern, cultivate good communication skills, maintain confidentiality, maintain documentations and record, refer the patient in time, update your knowledge. You cannot say, I told you, the court will not accept the excuse, I did not know. Establish a very good rapport. So beware, be aware, and be safe. Thank you.
Thank you, ma'am. It was very crisp and such a vast topic to cover in a nutshell. As you correctly said, each slide was a topic.
Thank you so much.
And actually, yeah, we really will make another 3 to 4 people aware for the same to make the count. to
Become members.
Above
I shall
100.
post the link.
Yes, please. I request Nihal Shah ma'am and Satish Shahane sir to felicitate Bela ma'am. Chalo, Madhuri ma'am. Come on. Say, हो गया फिर.
People are leaving, we start talking.
ठीक है. So here we conclude the day 1. So again, banquet coupons are available at registration counter. We will start banquet at 7. There is a lot of exciting events. So please don't miss it. And poster presentations results will be announced tomorrow around lunchtime. So all the students, please take a note.
Please collect the delegate kits. They are still at the reception counter. They will be available tomorrow as well. Yes, ma'am. Sure.
Today only they have to submit the report, annual report.
I'll also send you one. I've taken
Yeah. You took, na?
Ma'am, slide 8, just
I know, no. Chalega. Thank you. आप भेज देना.
नहीं, slide